Dan?
Good morning, Andrew.
It's disturbing to hear that again, isn't it? That's a guy in Slough, I think it was on Tuesday, saying, no rules are going to change my life. I'm going to do what I want. What do you say to people in the town who have that thought this morning?
Well, what I would say to everybody is please follow government guidance. The messages around hands, face, space, so washing our hands regularly, maintaining our social distance as well. I think these sort of things are important because many of us will be aware of the number of deaths of our loved ones within Slough. Now, that had a devastating impact on the community. So we, more than most, should be aware of that this isn't just some sort of scamdemic or some passing thing. We need to be very, very careful. Around the world, there have been more than 1 million deaths, there's millions of cases. So that is why we need to take it seriously, and that's the scientific advice, that's the government advice, and I sincerely hope that the good people of Slough will follow government guidance in order to protect themselves and their loved ones.
Because Slough Borough Council have been pushing, the Public Health Director has been pushing, you've been pushing, and the government has now said, yep, OK, Slough needs to be in Tier 2 restrictions, which means no household mixing indoors as of tomorrow. It only works, though, if people behave differently as a result of those rules being changed, because in the end, it's only our behaviour that can make any difference.
That is very eloquently put, Andrew. I think that's exactly. There's no point in the tier system. There's no point in any system if it's not going to be followed. The whole point is that of going into tier 2. And by the way, Andrew, neither myself, the council leader, or the council chief executive, or the Department for Public Health Director, even when I had the meeting yesterday with the Health Minister Nadine Dorries, we don't want to be going into a higher tier. This isn't why the likes of myself came into politics, is to place more restrictions. But the alarming increase in rates means that if we don't take preventative measures now, then we will be sorry later. It's a case that because the community transmission, by the way, is not just in a particular age, it's across, especially the working age group. And so we thought that if we don't take steps now, then the cases, the number of cases and the number of fatalities will only increase. So at the moment, we are above 140 cases, which, per 100,000, which is not good at all for us. And people do need to follow that guidance, because otherwise it could well be one of our loved ones. And I know that there are some who are younger who may feel, oh, look, 1 minute, I've been told that predominantly it has more of a fatal effect on those who are older. Well, no, that's not entirely true either, because younger people have also lost their lives. People of all backgrounds, of all ages, have been lost to this virus. So we need to be very, very careful, and we need to do our level best in order that we can get back to some sort of semblance of normality.
And people can hear the passion in your voice when you say that, and I just draw attention to the fact that you've lost family members. You yourself have lost family members to COVID-19 this year.
Yeah, definitely, Andrew. I mean, my grandmother passed away, and she, while she was on a hospital deathbed, we couldn't even go to see her. And as I've said previously in the chamber as well, I couldn't even carry her coffin on my shoulders. My taxi driver uncle, who was very, very well liked on the Slough taxi rank, he was the life and soul of the party. He was fairly healthy. We were shocked when he was put on a ventilator after he'd somehow contracted COVID. And my brother-in-law's father, similarly, he was in a care home, and somehow he also contracted COVID and he passed away. So this is very real, and we need to take it seriously, if not for our sake, definitely for the sake of our loved ones.
Tan, thank you very much indeed for coming on.